This video will cover the cytogenetics to remember about MDS. Before beginning, I just want to mention that a wide variety of complex cytogenetic abnormalities are more commonly associated with MDS. The abnormalities we're going to cover in this video are less common, but also important to know. So let's start by anchoring ourselves. You know the craze nowadays with med spas? Well, it looks like even the powerful fast food company here wanted in on it. They created their own med spa named Cytocosmetics. The name cytocosmetics sounds like cytogenetics, and since it is owned by this company here, we'll remember MDS, since this company is what we've used in other videos to remember MDS. If you shorten the name of this company, you get to MDS, right? Okay, the first abnormality we're going to cover is monosomy 7. We're going to remember monosomy with this chrome monolith because chrome reminds us of chromosomes, and the mono part of monolith will remind us of monosomy. And to remember that this refers to chromosome 7, look where this monolith came from. It came from heaven because it has a halo on it. And the word heaven sounds similar to the number 7. The next abnormality is a 7q deletion. This one is obvious. Next, we have 5q deletion. As in other videos, the number 5 is represented by these beehives, since the words sound similar. And note that this exterminator character here is trying to exterminate or delete these beehives. This will help us remember 5q deletion. 20q deletion is another cytogenetic abnormality and is represented by our character Tweety here because Tweety sounds like the number 20. And oh no, Tweety has been such a huge help for us in so many videos. Why would they want to exterminate it now? The fact that they're also attempting to exterminate it or delete it will help us remember 20q deletion. I want to point out that both Tweety and the exterminator look like they're chilling. This is to remember the fact that deletion 5q and deletion 20q are known to be favorable cytogenetic abnormalities in MDS. Okay, now let's go to the last part of this video, which will be to cover a specific syndrome called MDS with 5q deletion syndrome. We've already covered 5q deletion, so no need to do that again, but we're going to add some more stuff about the syndrome in specific. And remember, everything from this point on is specific to MDS with 5q deletion syndrome. The demographic of patient affected tends to be elderly women, self-explanatory. Bone marrow biopsy in these patients often shows monolobate megakaryocytes. To represent megakaryocytes, we have the exterminator's sidekick friend here. And you guessed it, you know who it is. This prompt is actually a little shout out to the infamous author of Kurt's Notes and endorser of these Pathobird videos too, Dr. Kurt Shaberg. Seriously guys, if you're in pathology and haven't been using Kurt's Notes, what are you doing? Anyways, coming back to the character, since her name sounds like megakaryocytes, and she's carrying one loaf of bread, which the word loaf sounds like the word lobe, that's what we're going to use to remember monolobate megakaryocytes. You may be wondering why she's carrying a bag full of plates. Well, that is to represent the fact that these patients commonly present with thrombocytosis. Our symbol for platelets are plates, and since there are a bunch of them in this bag, we'll remember thrombocytosis. The clownfish on the bag looks a lot like a certain character from a famous animated movie, right? Since Nemo sounds like anemia, that's how we're going to remember that these patients commonly also present with anemia.